This is my project for pharmacology, medication project video 1. During this video I will discuss 5 different drugs and I will identify the medication class for each medication, discuss the mechanism of action, talk about any side effects of the medication. Also we'll discuss if there are any lab values that are necessary to assess for patients while taking the medications. We'll explain any patient education that should be done during a nursing assessment. Okay, here we go. The 5 different drugs that we'll be discussing today are oxycodone, Xanax, Focalin, amoxicillin, phenobarbital. When discussing these 5 drugs, we'll go through the topics that we discussed in the last slide to get a better understanding of each medication. The first medication that we're going to discuss is oxycodone. It's part of the analgesic classification. Oxycodone is used in severe pain, used for pain relief, and also when used for pain, typically without loss of consciousness. Oxycodone is considered a Schedule II medication. I forgot to mention that in the last slide, but it is a Schedule II analgesic classified medication. Oxycodone's mechanism of action we're going to take a look at in this slide. Oxycodone is considered a semi-synthetic opioid, and its action is it binds to opiate receptors in the central nervous system. It changes perception of pain. If there's severe pain, it helps reduce the pain while producing a generalized central nervous system depression. And part of its therapeutic effects is, like I mentioned a minute ago, is decreased pain. Also on this slide, I chose to put mechanism of actions as well as side effects or potential side effects for medication use. Using oxycodone, there are side effects that can come up. Some of them can be constipation, drowsiness, nausea, vomiting. There are other reactions or side effects such as confusion, sedation, dizziness, blurred vision, nausea, vomiting, some GI obstructions, urinary retention, and then this it can also have a physical dependence or even a psychological dependence. Intolerance will build up when using this medication. In this next slide, we're still speaking about oxycodone. On the slide you'll see we're talking about patient education. So these are important factors that we need to tell our patients, or the patients need to know when utilizing this type of medication. And some of these are oxycodone may be taken with or without food. So the patient does not have to take it one way or the other. It can be taken either way. They should also be told not to chew the pill, not to break it, divide it, crush it, or the tablet, excuse me. They should not be dissolved, and that they should also avoid alcohol while taking this medication. Most patients should also avoid heavy machinery or operating any machinery. Driving cars can be very dangerous with some of the side effects such as sedation or dizziness, confusion, hallucinations, or like a floating feeling. Not good stuff to have going on if you're driving a forklift or a car or a truck or something like that. Some of the other patient education factors that should be given to the patient, that there's a potential for abuse, so they need to, maybe not even necessarily from themselves, but protect it from being stolen. Do not share the medication. That's very important. Don't it should be for whoever it was prescribed for, is who should be taking it. And let me back up one step to the driving and operating machinery. If the individual is experiencing drowsiness or dizziness, they should definitely call for assistance. And the patients also should not use during pregnancy or breastfeeding unless a doctor specifically recommended that the patient continues to take it after pregnancy is started. Okay, moving on to the next slide. Still speaking about oxycodone, and here we're going to take a look at how it is administered, and then also we'll look at a few things in terms of nursing assessments. So it is an oral medication. It comes in several different dosages, but typical 10, 15, 20, 30, 40, 60, and even up to 80 milligram tablets. And again, that's for oral administration, so the patients will be taking this medication orally. When looking at nursing assessments for patients who are on oxycodone, you're going to want to assess the pain 1 hour after initial administration, see if there's been any changes in pain, and then along with that we're going to assess blood pressure, preparation, and assess bowel functions, and then if the respiratory rate is low, consult the doctor, definitely, for sure. And then any prolonged use may lead to a dependency and tolerance buildup. These are important factors that we should be looking for when with a patient using oxycodone. Okay, we're moving on to our next medication that we're going to be looking at, and it is Xanax. It's in the benzodiazepine classification, and is used for anxiety and panic disorders, seizures and convulsions, insomnia or trouble sleeping, alcohol withdrawal even, and then sedation prior to surgery. When looking at this medication, it can be used for generalized anxiety disorder, panic disorder, and then anxiety that's also associated with depression. Also, Xanax has been given for irritable syndrome and other somatic symptoms with anxiety. Okay, looking at the mechanism of action for Xanax, and it binds non-specifically to benzodiazepine receptors, BNZ1, which impacts sleep. So it acts in different levels in the central nervous system, and can produce a central nervous depression. Some of the side effects that we're going to experience with Xanax: there's dizziness, drowsiness, lethargy, confusion, headaches, almost like a hangover feel, mental depression, a blurred vision. There's some GI constipation or diarrhea, nausea, vomiting. Can also cause weight gain. And then on the skin you'll see possibly rashes. And again, with this medication, a dependency and tolerance buildup can also be noted. Okay, on this next slide, we're looking at the Stowe Xanax and laboratory values. These are things that should be looked at during the usage of Xanax. And with this specific medication, in otherwise normally healthy patients, laboratory tests are not required typically. It is recommended that you monitor liver and renal function, but no specific laboratory results. And then also on this slide, we're going to look at the patient education for usage of Xanax. The patients should tell the doctor if their mental mood changes at all. That is very important. Another reason for them to contact their doctor if they have any hallucinations, if they have thoughts of suicide, the depression or anxiety worsens, they should also seek medical attention. If they notice any yellowing of their eyes or skin, again, they should contact their doctors immediately. The patients also should know that the medication will cause drowsiness and dizziness. So again, avoid driving, other activities. Again, we don't want anyone driving a forklift if they can't see straight. And then they should also not be using alcohol or avoid the use of alcohol or other central nervous system depressants unless consulted with a doctor. Patients can also be taught other methods that will help them decrease their anxiety, such as exercise or different groups, yoga, or relaxation techniques. And then again, like most medications or almost all medications, we should advise the patients to not share their medication with anyone. The medications are prescribed to them and they should only be used by them. Xanax is administered in tablets and it is for oral administration. 0.25, 0.5, 1 or 2 milligram dosages. So the nursing assessment for patients utilizing Xanax, assess for their mental status, if there's any changes one way or the other, check for drowsiness. There is a risk for falls, and also dependency is a risk. Again, we should assess to see if there's any anxiety or mental status changes, any headaches or dizziness, and if they do have headaches, it will or usually does go away after utilizing the medication for a little while. Alright, the next medication we're going to look at is phenobarbital. Phenobarbital is in the classification of barbiturate, and it is utilized in the treatment of seizures. Phenobarbital is a barbiturate that reduces excitatory synaptic responses by acting on GABA A receptors, GABA alpha receptors. Some of the side effects when utilizing this medication: agitation, confusion. It does cause some central nervous system depression. Patients can experience nightmares, nervousness, hallucinations, insomnia, anxiety, even dizziness, and have that because it does have effects on the central nervous system, so they can have that hangover feeling the next day, depression, vertigo. Phenobarbital lab values. There are things that you should consider in terms of lab. Patients on a longer usage should have their hepatic and renal functions tested periodically, and the usage of this medication may affect the whole blood or the serum, the plasma, and the plasma levels should be around 10 to 35. Having patients on this medication, we should be educating them that if they are pregnant or plan to be pregnant, it can harm unborn babies. And if they're not currently pregnant, it can make birth control less effective. So the combination of less effective birth control and unprotected sex is a consideration that the patient should take into account. The patient should also stop taking this medication right away if they get any hives, have difficulty breathing, or swelling of the face, lip, tongue, or throat. However, they should not just stop using the medication without talking to the doctor, even if it makes them feel better. What can happen is the patient can have actually increased seizures if they stop using the medication suddenly. So again, do not just stop taking this medication. An important factor to stress to the patient. Also, again, along with many other medications, may become habit forming. So another thing that we should educate our patient. Also, again, with all medications, they should be taking it as directed. And if they miss a dosage, they should take it as soon as possible, and not to double dosages. This medication can also cause daytime drowsiness, so any driving or activities that require them to be extremely alert, they may be impacted by the usage of this medication. And then they should avoid alcohol and any other central nervous system depressants while using this medication or at the same time. And then if they have a fever or sore throat, any sores that show up on their mouth, weird bruises or nosebleeds, they should contact their doctor immediately. And with this medication, also good thing to educate the patient is that the best sleep techniques. So when taking this medication, they're going to want a dark room. They're going to want it to be nice and quiet. and they don't want to be napping throughout the day. And any avoidance of caffeine and nicotine are recommended. This medication is available in several different forms of administration via, excuse me, tablets, an elixir, or IV. And then the assessment skills for this medication going to want to monitor the respiratory status, monitor the pulse and blood pressure of the patient, and then look for any swelling in face, throat, tongue, mouth. And specifically those swelling for patients receiving the medication through IV. And then respiratory depression can occur with the use of this medication, so it is recommended that any within a medical setting, any artificial ventilation and rescue equipment should be available. And the next medication we're going to be looking at is Focalin, and it is within the classification of the central nervous system stimulant. It's a Schedule 2 medication or Schedule 2 drug with a pregnancy category C. Utilized for treatment of ADHD. Okay, and now we're going to take a look at the mechanism of action for Focalin. So it produces a central nervous and a respiratory stimulation, and increases the attention span of patients with ADHD. Some of the side effects for this medication: hallucinations, insomnia, mania, nervousness, GI pain, anorexia, nausea, growth suppression, and weight loss. Some twitching can possibly happen. And then the weight loss is usually with prolonged use, so over time. So it is important to maintain records of weight and growth. For Focalin, the only thing that I could really see for lab values that should be considered is when receiving a long-term therapy. Monitor CBC and differential and platelet counts periodically with the patients, but again with prolonged use. Otherwise, going to want to track any weight and growth. And with patients taking this medication, again, we're going to want to provide them with patient or even family teachings. So we're going to educate them that they need to take this medication as directed. They if a dose is missed, they need to take that remaining dose for that day, but don't double the doses, and take the last dose prior to 6 p.m. to minimize any kind of insomnia. The patient should also not share the medication. Again, just like any other medications, they were prescribed. It was prescribed for them. They should also call their doctor if they feel any numbness or have any changes in skin color. Contact medical help if their nervousness, dizziness, or dry mouth becomes extremely excessive. And then also let them know that a drug holiday may be needed, and to let their doctor know about any pregnancy. or also to let their doctor know if they've ever abused or been dependent on alcohol or drugs, and to advise their school nurse, if they're in school, of medication regimen, and how they should be properly taking their medication. Okay, the last medication that we're going to be taking a look at during this presentation is amoxicillin. And amoxicillin is within the aminopenicillin classification, anti-infective medication used for any skin infections or respiratory infections. And amoxicillin's mechanism of action is it binds to the bacterial cell walls and kills the cells, or kills the bacteria. And some of the side effects with the usage of amoxicillin could be seizures, and that is typically with a high dose, and then diarrhea, nausea, vomiting, increase in liver enzymes, skin rashes, and then, of course, allergic reactions that we hear about often, and superinfections. All right, with amoxicillin, some of the lab values that should be taken into consideration when you have a patient who may be using this medication. It may cause an increase in serum alkaline phosphatase, LDH, AST, and ALT concentrations. And then this use of this medication may also cause a false positive Coombs test results. Some of the patient education that we can provide our patients when utilizing this medication is that they need to complete the medication as prescribed, and to finish it completely. Even if they're already starting to feel better, they should they need to take the whole regimen. And then again, do not share the medication, as sharing medications is dangerous. And then advise the patients to talk to the doctors if they have any signs of a superinfection. So overgrowth on the tongue, vaginal itching or discharge, loose or foul smelling stools, any kind of like allergic reactions. They should notify their doctor immediately. And they should notify a healthcare professional immediately if they have diarrhea, abdominal cramping, fever, blood in their stools, or patients who may be on birth control or relying on birth control. Amoxicillin can make it less effective. So, so teaching our patients this is obviously very, very important. And then instruct female patients taking oral contraceptives to use an alternative non-hormonal method of contraception during therapy of amoxicillin until their next period. Okay, amoxicillin is an oral medication, and the patients will take this medication orally. When assessing a patient utilizing this medication, you're going to assess for infection. Again, that's why they're taking this, to help fight off a bacterial infection. So we should be checking for signs of any kind of rash. If they have a wheezing, should monitor for bowel function, make sure that they're utilizing the bathroom on a regular schedule. If they have any diarrhea, abdominal cramping, any fever, or blood in their stool, they should report back to their doctor right away. And depending on what's going on, educate the customer, educate the patient that it may take some time for the medication to work. It's not They're not going to take one dose and be magically better. It can take up to a couple weeks depending on what's going on.